Sleep paralysis, causes, symptoms, and treatment. It's on Life Science by Nicoletta Lanise. We've all experienced this, even from a young age. And unfortunately, a lot of people have spiritual experiences, but let's see what happens. Sleep paralysis locks a person in a weird state between waking and dreaming, where they can't move, but might experience odd hallucinations. Actually, a lot of them are not hallucinations. Now, there is a spiritual battle, actually. People may wake in the middle of the night and find themselves unable to move or utter a sound. They might see a shadowy figure hovering in the corner, feel a pressure on their chest, or a hand around their throat. Other times they feel removed from their frozen bodies as if floating out of their bed sheets, and these bizarre experiences are known as sleep paralysis, a diagnosable and fairly common sleeping disorder. Prevalence throughout history, references to such sleep paralysis scattered throughout history, though not usually under the name sleep paralysis. Folklore and myths from around the world describe the terrifying experience of being unable to move upon waking, and sometimes seeing beings being choked or being held down, nightmares known as the Old Hag in Newfoundland, Kokma in St. Lucia, Tsog in East Asia, and may have all been born of the same spooky experience, according to an article in the Journal of the Royal Society of Medicine. In 1664, a Dutch physician described a patient's experience of sleep paralysis as the incubus or the nightmare, providing the first known clinical description of the affliction. According to a 2011 review, about 7.6% of the world's population experienced at least one episode of sleep paralysis in their lifetime, with higher rates noted among students and psychiatric patients, particularly with those with post-traumatic stress or panic disorder. Sleep paralysis is also a common symptom of narcolepsy. It's a condition characterized by excessive sleepiness, sleep attacks, and sudden loss of muscle control, as described by the National Sleep Foundation. Sleep paralysis, in the absence of narcolepsy, is known as isolated sleep paralysis or recurrent isolated sleep paralysis if it occurs repeatedly. Now, there's temporary paralysis, and with it comes vivid hallucinations. Nowadays, scientists have gained a better understanding of sleep paralysis as a neurological disorder rather than a brush with the paranormal. Sleep paralysis arises from disrupted REM sleep, named for the rapid eye movement that occurs during this stage of the sleep cycle. During sleep paralysis, you have two aspects of REM sleep going on when you're awake, said Brian Sharpless, a licensed clinical psychologist and co-author of the book Sleep Paralysis, Historical, Psychological, and Medical Perspectives by Oxford University Press 2015 edition. You're most likely to experience dreaming during REM sleep, he said, and the body actually becomes paralyzed, presumably so you don't try to act out your dreams. During an episode of sleep paralysis, a person becomes paralyzed for seconds or minutes, just as they're falling asleep or waking up. While frozen beneath their bed sheets, many people also experience vivid hallucinations. People who have experienced sleep paralysis often describe sensing an evil presence in the room with them. A study published in the journal Sleep Medicine last month reported that out of 185 patients diagnosed with sleep paralysis, about 58% sensed a presence in the room with them, usually something non-human, and about 22% actually saw a person in the room, usually a stranger. Sleep paralysis may also cause people to feel pressure on their chest or feel as though their body is moving without them directing it, according to the American Sleep Association. Sometimes people find the out-of-body hallucinations pleasant and feel as if they're weightless, but more often the sensations can be quite disturbing. Like paralysis, these hallucinations may also be a lingering manifestation of REM sleep. Quote, we know the amygdala is highly reactive to REM, which is important to fear and emotional memory, said Daniels Dennis, a postdoctoral scholar in psychiatry at the Beth Israel Deaconess Medical Center in Boston. He says you have part of the brain actively responding to fear or something emotional, but nothing in the environment to account for that. So the brain comes up with a solution to that paradox. That's one possible explanation, he said. But the actual cause of the hallucination is still unknown. Risk factors and treatment. A myriad of factors, including substance use, genetic factors, a history of trauma, a psychiatric diagnosis, and poor physical condition and sleep quality, may increase the risk of developing sleep paralysis, according to a 2018 review. The frequency and severity of episodes has also been linked to anxiety-like symptoms and sleep deprivation. He said, this may explain why sleep paralysis comes in waves or bouts. Episodes might coincide with a period of stress. But there's no set treatment for sleep paralysis, but doctors usually direct diagnosed patients to improve their sleep schedule and maintain a better bedtime routine. In more extreme cases, patients may be prescribed a low dose of antidepressants, according to the National Health Society of the UK. These medications may help mediate the symptoms of sleep paralysis by suppressing certain aspects of REM sleep. So what should you do if you experience sleep paralysis? If you have rare episodes of sleep paralysis but have not been seen by a sleep specialist, make sure your sleep hygiene is solid. This is what Shelby Harris, Director of Behavioral Sleep Medicine at the Sleep Wake Disorder Center at Montefiore Health System, Bronx, New York City, said. He said, for example, sleep paralysis can be a sign that you're sleep deprived. Harris suggests that people experiencing sleep paralysis should make sure to get enough sleep on a regular basis, avoid alcohol, nicotine, and drugs drugs all night, starting 3 hours before bedtime. They should also limit caffeine after 2 p.m. and keep electronics out of the bedroom. If these things don't help, and you're having episodes that are becoming somewhat more frequent, see a sleep specialist to see if there's any underlying medical disorder that might be causing the sleep paralysis, Harris said. Okay, but we also know that this is a spiritual thing. For example, when you have these attacks, the minute you say the word, the name Jesus Christ, or Christ help me, Lord help me, the attacks stop. Or when you try to do the sign of the cross, the attack stops. But of course you can't do the sign of the cross because you're paralyzed. But just thinking, Lord Jesus Christ help me, Lord have mercy, Christ have mercy, they stop. So that means that obviously it's not sleep deprivation. Of course, you usually also can have these attacks when you're doing something as you're a Christian doing something good. People may know, people may not know that you're doing something favorable in God's eyes. You do get these types of experiences. And it's not uncommon to have something like this. It's a part of the spiritual life, and the Lord allows it to happen so that you will learn how to fight back using the power of His name. So if you do have such an experience, try using the power of the name Jesus Christ. If you'd like to join me on my Patreon account, you will hear content not covered by mainstream media. These riveting stories will be based on my research, and I will state my opinions and give my personal insight on diverse and controversial subjects and world events not covered by mainstream media, and not supported by YouTube guidelines. So whatever I have on my Patreon, most of those will not be on my YouTube channel. Please consider becoming a member today. More of the most significant and important videos will be on my Patreon channel. Your support helps me to continue my research and keeps this YouTube channel alive. And we depend on your support, your generous charity, because we help economically challenged families here in Athens, Greece, in Kapota, and we also help the young generation with university tuition and the community around our church. Thank you.